Person number 1, person number 2, person number 3 and 4, person number 5, person number 6, person number 7, and person number 8. And then my note cards are right here. And here you go, Catherine. Is it straight? Okay. If you pass pills on the street, you're considered a drug dealer, but if you do it in a healthcare facility, you're a nurse. I myself am a nurse, and I'm the person who has to give hundreds of meds to people on a daily basis. I think that it would be more important if we were able to find alternative therapies in order to help people, such as aromatherapy. Today we're going to discuss what aromatherapy is, the essential oils that are used for them, as well as how to use a diffuser in order to use these essential oils. The NAHA, which is the National Association for Holistic Aromatherapy, defines aromatherapy as the art and science of utilizing naturally extracted aromatic essences from plants to balance, harmonize, and promote the health of body, mind, and spirit. Essential oil therapy is also another name for aromatherapy because of the oils that are used. Plants and humans can use these alike. Renee Marie Scatafassi completed research on this in the early 1930s and proved that we can use aromatherapy and essential oils in order to help physical and mental ailments. The Journal of Intensive and Critical Care Nursing says that the French consider aromatherapy a medical specialty, and the British utilize aromatherapy as an alternative and complementary practice. Now that we know about aromatherapy, we can begin to discuss the oils that are used. The International Organization of Standardization defines essential oils as a product made by distillation with either water or steam, and states that after distillation, the essential oil is physically separated from the water phase itself, meaning that the oil and the water are no longer connected at all, and you get a small vial like this. Plants and humans use these alike, as I stated before, and the Journal of Pediatric Nursing states that essential oils may inhibit microbial growth, support wound treatment, and facilitate healing. The Journal of Intensive Care and Critical Care Nursing says that the use of essential oils does have an effect on workplace stress. In order to use these oils to our benefit, we will now discuss which oils we can use to help with stress, depression, anxiety, and other physical ailments. The most commonly used essential oils are clary sage, which is an aphrodisiac, eucalyptus, which is a decongestant, ginger, which is used for digestion, lavender, which helps with the depression that we discussed, as well as anxiety, lemon, which is used for an immune support, lemongrass, which is an antiviral, and the most versatile essential oil that we will talk about, which is tea tree oil. This can be used for antimicrobial, antibacterial, antifungal, and antiviral purposes. All of these oils and uses, as well as many more, can be found on the National Association for Holistic Aromatherapy's website. The NAHA states common ways to use aromatherapy. This includes in showers and baths, as well as steam treatments for your face and your sinuses, and the most common way, which is a diffuser. These are widely available and can be found from a varying price range of $5 up into the hundreds. Now we can discuss how to use one of these diffusers in order to use aromatherapy. Jennifer Lane outlines how to use a diffuser on her Loving Essential Oils blog, and I will outline that now. So first, you're going to find an open area in a room with a solid surface, and you're going to take your diffuser and separate it as needed. There will be a fill line inside of the diffuser. You will take water that's room temperature and fill to the fill line. After you fill to the fill line, you will then add 3 to 10 drops of essential oils. That's about 10. Then you're going to place the cap, or if there's a different vented cap, onto the diffuser as necessary, and then you'll find your on switch, and you'll be able to select how many hours or the heat that you would like to use. Soon, this will begin to steam and your essential oils will be diffused into the room. Now that we've discussed what essential oils are, the use of aromatherapy, as well as how to use a diffuser, we can choose treatments that aren't medications. We can choose to use aromatherapy in order to help people, instead of using medications that have a list of side effects that are a mile long that we'll then have to choose more medications to help with. I think it's about time that we choose to do things that will help and not harm. Now that I've concluded my speech, it is time for a question and answer session. Does anyone have any questions at this time? Yes?
Are there any FDA approved aromatherapies?
There have been research done on aromatherapy itself, and it's starting to be implemented in different hospitals behind nurses' stations. There's no approved use in hospitals itself for patient care at this time.
Do you believe, follow-on question,
Okay.
do you believe that the lobbying of pharmaceuticals as well as insurance companies is going to prevent the use of aromatherapies in hospitals?
I 100% agree with that. To me, Big Pharma is the devil. They use medications in order to promote their own growth and financial gain. And when they give people these medications, they know the side effects that are possible. Though it says that doctors can't get kickbacks, they still do for prescriptions. And they are compensated in other ways. When we prescribe people narcotics, antidepressants, and things, they're not used properly. People give people medications for things that aren't on the labeled use. That's how they came about with Viagra. It was originally intended for hearts, and now people use it for their penis.
Oh, yes.
Sorry. Any other questions?
More? Where does the United States rank as far as holistic use?
We are not one of the higher used holistically. Typically, we tend to focus on only the area. So if you come into the hospital and you break your arm, they're like, oh, you broke your arm, we'll give you a cast. They're not going to focus on the fact that you have a vitamin deficiency or anything like that. They're going to say, oh, you fell and you broke your arm. That's it. They're going to treat that specific area. Whereas if we were to look at the entire picture, we would be able to see issues that other people have.
Did you know that you could use essential oils on the bottom of your feet?
Yes, I do know that. You can't only use them for aromatherapy. Essential oils have other uses. You can use them topically. Some are used ingested, which can help with your digestive tract as well as other respiratory disorders. Does anyone else have any questions at this time? All right, and at that concludes the speech.